ബഹുമാനപ്പെട്ട നമ്മളെല്ലാവരും ആദരിക്കുന്ന നമ്മുടെ അധ്യക്ഷൻ ശ്രീ കോടിയേരി ബാലകൃഷ്ണൻ, Trivandrum Oncology Clubിൻ്റെ പ്രസിഡൻ്റായ ഡോക്ടർ ജയപ്രകാശ്, ഫാദർ ബിനു കുന്നത്ത്, ഡോക്ടർ ബോബൻ തോമസ്, ഡോക്ടർ ചന്ദ്രമോഹനൻ, ഇവിടെ ഇരിക്കുന്ന എല്ലാ വിശിഷ്ട വ്യക്തികളെ, ഈ സെമിനാറിൽ സംസാരിക്കാൻ പോകുന്ന സ്പീക്കേഴ്സ്, സുഹൃത്തുക്കളെ, എല്ലാവർക്കും എൻ്റെ വിനീതമായ നമസ്കാരം. എന്നോട് പ്രത്യേകിച്ച് ട്രിവാൻഡ്രം ഓങ്കോളജി ക്ലബ്ബ് ആവശ്യപ്പെട്ടത് ഇംഗ്ലീഷിൽ സംസാരിക്കാനാണ്. ഞങ്ങളുടെ അനുവാദത്തോടെ ഞാൻ രണ്ട് വാക്ക് ഇംഗ്ലീഷിൽ പറയട്ടെ. It really is a pleasure to be with you once again, this time on the occasion of the 10th anniversary of the distinguished Trivandrum Oncology Club. I was here earlier, as you saw from one of the photographs, one of the slides in the film. I've inaugurated an earlier annual gathering, but the 10th is a very special occasion, and your Trivandrum Oncology Club has, in the course of this last decade, earned a very well-deserved reputation of being one of our nation's foremost professional oncologist associations. But equally, it has been heartening to note how this organization has not restricted itself merely to social and networking events, as was initially expected 10 years ago. Instead, we must appreciate the special emphasis the club has placed on social service and the manner in which you have all worked to utilize the expertise of your membership for the benefit of people across southern Kerala. Whether it's through the many awareness campaigns you've undertaken, or the health camps dedicated to the socially disadvantaged, or even through the various seminar and research-related programs that you have organized to further expand and refine our understanding of cancer and its treatment. Now, if at all I even needed to discuss and say anything about the scale of the challenge posed by cancer, I think I could have immediately shut up after hearing the very powerful and moving remarks of Sri Kodiyeri Balakrishnan. He is a fighter, and I think we admire him not just because he is a cancer survivor, but because he has not let his illness define him or come in the way of his many activities and his hard work. അദ്ദേഹത്തിന് രാഷ്ട്രീയമുണ്ട്, പക്ഷെ അതിനെക്കുറിച്ച് ഞാൻ പറയുന്നില്ല. എന്നാലും അദ്ദേഹം ചെയ്ത ഓരോരോ കാര്യത്തിൽ എനിക്ക് പ്രത്യേകിച്ച് വലിയൊരു അഡ്മിറേഷനാണ്. ഞാൻ ഒരു രഹസ്യമൊന്ന് പറഞ്ഞാൽ നമുക്ക് പിന്നെ വിരോധമുണ്ടാവില്ല. ഇന്നും കൂടി അദ്ദേഹം കീമോതെറാപ്പി ട്രീറ്റ്മെൻറ്റ് എടുത്തിട്ടാണ് ഇവിടെ എത്തിയിരിക്കുന്നത്. വാട്ട് എ ഫൈറ്റർ ഈസ്. ഐ തിങ്ക് ഹി ഡിസേർവ്സ് അവർ അപ്ലോസ്. Sorry, going back to English, I must say that this is nonetheless, despite individual stories like Mr. Kodiyeri Balakrishnan's, it is a serious public health crisis. And as a policy person, somebody who thinks about public policy as my profession, if you like, I genuinely believe that we have a particular challenge in the state of Kerala, and also for India as a whole, but particularly in Kerala. Now, many of you oncologists are certainly familiar with the famous or notorious article in 2016 in the British medical journal, The Lancet, which pointed out that Kerala had earned the unwanted reputation of being home to the largest number of cancer incidences among states in the country, closely followed by Mizoram, Haryana, and Delhi, but Kerala, sadly, is number one. In fact, our numbers were substantively larger than the national estimates for the year. That year, 2016, I think we had 135.3 per 1 lakh people, compared to the national 106.6 per 1 lakh people. So for every 1 lakh in population, you have 135 diagnosed cases of cancer. Now, that's a very serious thing, because we also know, and Dr. Boban Thomas's excellent book makes the same point, that very often cancer is not diagnosed at all, or is sometimes diagnosed too late to do anything about it. Even more worryingly, therefore, our state, Kerala, has witnessed the largest number of mortalities per head of population compared to any of our counterparts. So we may say that Mizoram and Haryana and Delhi are not far behind, but in terms of not just incidence, but mortality, we are way ahead. Now, I remember raising a question in Parliament a couple of years ago, when the then Minister for Health and Family Welfare had pointed out that Uttar Pradesh, Bihar, and Maharashtra had the highest incidences of cancer cases, as per estimates provided by the National Cancer Registry Program of the Indian Council of Medical Research. But it turned out that Kerala not being in the top slot was not due to a significant reduction in cases, but merely because in those states that year there had been a sad increase in the number of cases. Now, these high incidences of cancer across the country, and particularly in Kerala, is really at odds with what we all celebrate as the successful development trajectory of the state. Across the world, there's been growing admiration for the Kerala model of development, which has been definitely driven by consistently impressive performances on most socioeconomic parameters, whichever party has been ruling. In addition to having the highest literacy rate in the country, we have also a declining birth rate, we have higher life expectancy. I'd like to think, and Mrs. Kodieri, I'm sure, will not contradict me, we have more empowered women and a stronger welfare support for the poor and indigent and the marginalized. Our state perhaps uniquely offers universalized access to healthcare, and the medical information that's available to our public is also quite exceptional by Indian standards. One of the reasons that Kerala has survived successive instances of virus outbreaks is because we have a well-prepared and dedicated medical infrastructure. Why then have we been unable to extend the same success story to our handling of cancer and its treatment? ഇതാണ് നമ്മളെല്ലാവരും മനസ്സിലൊരു പ്രശ്നം. എന്തുകൊണ്ടാണ് കേരളത്തിൽ ഇത്ര നല്ലൊരു മെഡിക്കൽ ഇൻഫ്രാസ്ട്രക്ചർ ഉള്ള സംസ്ഥാനത്തിൽ ക്യാൻസറിൽ മാത്രം ഇത്ര വലിയൊരു വീഴ്ച? We have really, policy makers have to think about this very seriously. Now, there are three obvious and essential challenges we must contend with in order to develop a more sustainable and therefore more successful approach towards cancer care. I think we've already heard prevention of the disease is absolutely essential. Detection of the disease, obviously, if we are to successfully address the third challenge, which is the treatment of the disease. And finally, when and if we get to a stage where treatment doesn't work, then palliative care as well. There is one thing in which Kerala has been a leader in terms of national approaches to palliative care. But that too is a sad story, because palliative care is after you have admitted you can't do anything to save the life of the patient. We need to act earlier and sooner. Now, everyone understands how important it is to increase cancer awareness. I don't think we need to stress about that. We also know there are various stories about our own bad habits that contribute to the incidence of serious illnesses. Food, the wrong kinds of food, the wrong kinds of alcohol, not exactly balanced diets, very sedentary lifestyle, and not enough sort of exercise and physical activity. All of this, I don't want to keep repeating it. We say this in the context of diabetes, we say it in the context of blood pressure, we say it in the context of cancer as well. We also have ourselves to blame for where we are. And the truth is that that even where the person is aware, our tendency very often is to think that we can live as we please and pop a few pills to cope with the consequences. That doesn't actually work. The WHO has estimated that over 1/3 of all cancer cases in the world are caused by 5 main lifestyle-related factors: high body mass index, so being overweight; low fruit and vegetable intake, which should not be an issue in Kerala where everything grows so abundantly; lack of physical activity; consumption of tobacco; and of course, drinking large quantities of alcohol. And the fact is, in all these 5 items, I'm sorry to say that the majority of our fellow Malayalis would be found wanting by the doctors present here today. Now, I know we can't change people's lifestyle choices overnight, but I think the importance of public awareness becomes all the more essential in that context, and I certainly hope that we can increase through all the measures at our command, including, of course, through books like Bourbon Thomas's or personal experiences like Kodiyeri Balakrishnan's, we can increase more public awareness amongst Keralites. We can also help change lifestyles and the same thing for other lifestyle-related illnesses, heart, diabetes, liver, and so on. Now then we get to the two other key issues of detection and treatment. It's a universally acknowledged fact that early detection through screening can help us to limit the impact and spread of cancer. But in Kerala, as again Dr. Bourbon Thomas's book makes it amply clear, there is no doubt that very many patients find out too late that they have a problem, and then it becomes an insurmountable challenge. I think in that sense, Kodiyeri Balakrishnan was a bit luckier that a checkup, a routine checkup in another field, led the doctor to identify that he had a potential problem in cancer, which then turned out to be real. Unfortunately, many of our folks don't do that. They don't even go for routine checkups, and the result is they miss out on finding this. One example is breast cancer, which Dr. Bourbon Thomas has written about. Another is cervical cancer. I have read widely that cervical cancer is actually the most easily preventable cancer through screening, and of course treatments like HPV vaccinations. And yet, do you know that India accounts for over 20% of the global total of cervical cancer cases? That is truly, truly alarming. About 1 lakh of Indian women are diagnosed with cervical cancer every year, and 2 out of 3 of them eventually die. So we are losing 60,000 lives of mothers, sisters, workers, homemakers, providers for something that could have been screened routinely and early enough and solved. This is a truly depressing statistic. And I think the twin challenges of lack of awareness and perhaps not enough access to adequate healthcare screening form a deadly combination. I hope that Kerala can blaze the path forward, that as we improve publicly available healthcare and health facilities, that we can also definitely improve screening for preventable illnesses like cervical cancer. In the UK, for instance, I know the UK is a more developed country and so on, but an HPV vaccine is mandatory for any girl between 12 and 14. In India, there is so little awareness of even such a simple established method of treatment. There was this year a particular study that I've seen that looked at 1,500 women in the state of Haryana, 700 from urban areas, 800 from rural areas. And those from rural backgrounds had really no understanding of what cervical cancer was. 55% didn't know about it at all. 75% didn't even know about screening. 95% didn't know about the vaccine. Now that's the awareness challenge that we have. Now Haryana is Haryana, Kerala is Kerala. I would like to think we can do better in Kerala. Now, part of the problem with expanding access to early screening is that much of the cancer-related programs and protocols that are in place have been limited to those being carried out by the government, including here in Kerala, but there are obviously limitations in what one state government can do alone, especially considering the already immense burden on our public health infrastructures, which, of course, are already reeling from 2 waves of the COVID-19 pandemic. And then we do have funding limitations. I don't want to pretend that Kerala has cracked that particular aspect of it. We are doing much better than most states, but we don't have enough resources in public health either. And that's something that we can all collectively, as public-minded citizens, opinion shapers, leaders in society, we can make that point very clear. And then we come to treatment, which of course, for the majority of Indians is provided by the public health system. We have our own example in Thiruvananthapuram's RCC, which I am very proud of, which has a well-deserved reputation for providing world-class treatment at affordable costs. I had fought an unsuccessful battle to get it upgraded to an institute of national importance and get them more funding. But they have got little more funding from the center last year, and we will see what we can do to keep on expanding their capacity to address the problems. But since RCC gets patients not only from southern Kerala but also from neighboring states, particularly southern Tamil Nadu and so on, they are definitely overburdened. There is a huge amount of pressure. And the sad thing is, world-class treatment at affordable cost is not available anywhere else. I mean, I know that there are private hospitals, including some that the doctors here work for, that have good reputations and are excellent, but charge a lot. So for the ordinary person, RCC is so important. And I have given whatever I could from my own MP funds and my own personal support. I have been there multiple times, and I was very pleased when some civic-minded organizations have also set up free hostels next to the RCC. So people coming from other parts of Kerala who cannot afford to live in Thiruvananthapuram while they're being treated, that they can stay for free in these hostelries like the C.H. Muhammad Koya Center and other such places. Now, I would argue that for us to expect the public sector to primarily shoulder the responsibility of cancer treatment is not sustainable. And I think to just deal with the growing incidence of cancer cases, everyone has to chip in. Public sector, private sector, NGOs, everyone. And I'm glad to see from the program you have shown me that you will hear everyone's voices during your program. That you have actually Karkinos talking about the private sector, you've got people coming and talking about NGOs and civic society. Abby George had just spoken about that earlier. As an MP whose office deals with countless cases of requests for access to cancer treatment, I send whatever I can to the Prime Minister's National Fund. Only a handful actually get picked up because the sheer volumes, coupled with the intensive and prolonged nature of the treatment required and the costs associated with that, makes it very difficult. And I can tell you from my own experience, I don't have any philanthropists here who can help, but sometimes I will get money from the Prime Minister's Fund for the actual surgery if it's in a government hospital. But once the surgery is over, continued treatment, medicines, and so on, are unsustainable for many patients, especially if the breadwinner is the one who's got the cancer. Because then he is no longer able to work. It's usually a he, it could be a she as well. He's unable to work and earn an income, and yet has more expenses because of continuing medical treatment. And I think this is something we have heard a lot of rhetorical speeches about insurance protections and so on. The fact is, in my own experience of people coming to me in my constituency, I can tell you that we are not able to do enough for them. And so there are too many people who are falling through the net of our whatever little social security we have in our society. I believe we can make good inroads if we develop a new collaborative approach towards cancer diagnosis and treatment, an approach where the efforts of the government can be complemented and supported by the expertise and capabilities of our private sector. For most of the country, access to cancer treatment at private hospitals remains unaffordable. It's completely because of the prohibitive costs. In fact, I saw the 2017-18 National Sample Survey particularly looked at the average total out-of-pocket cancer treatment costs. So the average out-of-pocket costs were 1.5 lakhs in a private establishment, but also 75,000 lakhs in a government hospital. So can you imagine? For many people, catching cancer is not just a sentence of death, it is a sentence of bankruptcy. They will often sell their homes, their assets, the roofs over their heads to be able to treat themselves. And the next generation will pay the price for our failure to provide truly universal health care in this generation. I have to say that this need not be the case if we can develop a new model that combines the strengths of the public and the private sector, including definitely doing much more cutting-edge research on treatments and protocols, working together to enhance the reach of early cancer detection screenings, or even collaborating on matters like raising awareness on ways to shore up our resilience against this disease. Such a PPP model for cancer treatment should not just look inwards, but should also harness the abundant talent pool that is present in our Marunadan Malayalis, our NRKs, our expatriate communities, many of whom have done very, very well in the medical profession in their respective countries. When I was working for the UN in America, many was the time I was invited to address annual gatherings of the Association of Kerala Medical Graduates. And believe me, they were usually in extremely lavish five-star hotels with millionaire doctors crowding into a ballroom 10 times the size of this one. Why can't we tap them as well? I'm sure they'd be willing to help. We just need a framework, a platform to drag them in here. So I'm sure that if we can create such a comprehensive approach, involve them as well as our private sector, as well as whatever we can do from the taxpayers' money, then I think we will have a way of beating this problem. And Kerala can show the way. That's why I'm so happy that Koderi Balakrishnan is here, because he can speak to his government, our government, which is also a government that he has more influence on than I have, to say that we need a more imaginative approach. You know, when COVID broke out, I read about a North Indian gentleman, he then contacted me, who was a cancer survivor and who had chosen to resettle in Kerala. And I asked him why. I was very impressed. He's a North Indian, doesn't speak a word of Malayalam, doesn't really know Kerala, didn't grow up here, didn't work here, nothing. He has chosen to. He said, because if I look at the healthcare infrastructure of all the states in India, Kerala is the place I would much rather risk being ill in. Now, the irony is the one disease in which that is probably still not true is cancer. So let's get our act together. Let us see if we can improve what we can do in Kerala. And let us urge the government and the private sector to come together, sit across the table, work out such a model, address the challenges that inevitably arise. And there will be, of course, the moment you get these Marunaran Malayali doctors, there will be people saying data privacy. If you get all this information about their patients, that will go to America. All of that we have to protect. We have to avoid creating any problems. But together, I am confident that we can develop a collaborative process that can pave the way towards making Kerala, our state, once more, a trailblazer in the field of cancer prevention, treatment, and, of course, cancer prevention, detection, and treatment. And then, yes, let's also keep up the palliative care. It's often said that at the end of the thing, it's not the days in your life that remain when you know your cancer cannot be cured, it's the life in your days. And that too, we can give people in Kerala a better life at the end of their innings. With those words, and with a great deal of admiration for all of you who are working so hard and so bravely in the front lines of fighting cancer, I'm proud to declare this 10th anniversary of the Trivandrum Oncology Club inaugurated. ഔപചാരികമായിട്ട് ഉദ്ഘാടനം ചെയ്തു. ഇനി ഡോക്ടർ ബോബൻ പോളിൻ്റെ പുസ്തക പ്രകാശനം കൂടി ഇതിനൊപ്പം ചെയ്യാനാണ് ഇവർ ആഗ്രഹിച്ചിട്ടുണ്ടായിരുന്നത് അല്ലേ? പുസ്തകമുണ്ടോ? തരൂ.
Thank you so much, sir, for your valuable words. Now we all are witnessing some golden moments, isn't it? Yes. Now we move on to the book release function. And I would like to share some words about the author as well as the book. പ്രിയ സുഹൃത്തും ആദരണീയനുമായ ഡോക്ടർ ബോബൻ തോമസ് വിവിധ മേഖലകളിൽ പ്രാഗൽഭ്യം തെളിയിച്ച ബഹുമുഖ പ്രതിഭയാണ്. തിരക്കേറിയ ഓങ്കോളജിസ്റ്റ്, യുവ ഡോക്ടർമാരുടെ പരിശീലകൻ, ഏറെ ശ്രദ്ധേയനായ സംരംഭകൻ എന്നീ നിലകളിൽ അറിയപ്പെടുന്ന ഇദ്ദേഹം അർബുദം അറിഞ്ഞതിനുമപ്പുറം എന്ന തൻ്റെ പുസ്തകത്തിൻ്റെ പ്രകാശനത്തിലൂടെ